Are patients who are having postmenopausal age group, are they at an increased risk of fracture? Yes, they are at an increased risk of fracture. Hello, this is Dr. Jayaditya Ghosh, consultant endocrinologist, Yashoda Hospital, Malakpet. So what happens in patients who are at increased risk of fractures postmenopausal age? Why does it happen? It happens because at this age there is decrease in the estrogen hormone level, which is beneficial for the bones. So once it stops, the bones become weak and they are at an increased risk of fractures. So what does increased risk of fracture mean? Even trivial trauma can lead to development of fracture. So what is trivial trauma? So trivial trauma means even fractures, like even when a person falls to a floor from a height of less than one's own height, it is known as a trivial trauma fracture. Even while walking downstairs during a steps can even lead to fractures sometimes. These are trivial trauma fractures, and these fractures can have long-term consequences in the form of debilitating conditions, fractures leading to operations later. So these are very complicated things that can happen if a person develops fracture. So who are at an increased risk of fractures apart from those who are at postmenopausal age group? Even patients who are using steroids, in patients who are having lactose intolerance, that is, who are not able to digest milk properly, those who have allergy to wheat related products, that is celiac disease, these patients are at an increased risk of developing osteoporosis. So this weakness of the bone is actually known as osteoporosis. So we should be very cautious regarding osteoporosis. So what can be the symptom of patients who present with osteoporosis? It can be very vague, that is, a patient may have a generalized body pain sometimes, and we do some DEXA scanning, which is a test which is required for the diagnosis of osteoporosis. So if a patient develops osteoporosis, we need to treat that so that the fracture can be prevented. The main aim is to prevent the fractures from happening and to have a good bone health so that the patient can do his or her normal things in his life. So ultimately there are certain treatments that has been approved for the treatment of osteoporosis. There are certain injections which can improve the bone health. That can be once yearly. That can be some other injections are also there which can be given every 6 monthly, and if the bone health is very poor, we give certain injections which are given daily, that can be taken by a patient himself or herself. So these certain medications can be given to patients of osteoporosis. Patients should be aware that there is a condition known as osteoporosis where the bones become weak, and these people are at an increased risk of fractures. So ultimately we should prevent these fractures and we should take care that osteoporosis should be dealt properly. Thank you.
If you found this video useful, like, comment, and subscribe for more health updates.